This is just a short topic, around 30 minutes siguro. Thank you.
Our next topic is about diseases of immunity. So what is immunity? Okay, so immunity refers to the protection against infection. So immune system is the collection of cells and molecules that are responsible for defending us against the countless pathogenic microbes in our environment. Usually, it works effectively, but illness may result from inadequate immune activity, excessive immune activity, and inappropriate immune activity. So technically, this immunity, very controversial siya ngayong panahon na to due to pandemic because of the presence of the vaccines. Diba? Dahil pinag-uusapan natin yung tungkol sa bakuna, and then our vaccines, alam naman natin, will help us, okay, in our immunity. Okay, they can develop certain antibodies against a certain disease. Okay, so what is an antigen? An antigen is a substance or molecule that, when introduced into our body, triggers the production of an antibody by the immune system, which will then kill or neutralize the antigen that is recognized as a foreign and potentially harmful invader. So technically, our antigen, these are all your foreign body materials or foreign body organism that enters our body. So katulad halimbawa ng COVID-19, the COVID virus, kapag pumasok siya or na-infect ka with your COVID virus, your body will try to make an antibody against this type of antigen. Okay? Next is an antibody. An antibody is also known as an immunoglobulin. It is a large Y-shaped protein used by the immune system to identify and neutralize the foreign objects, such as bacteria and viruses. So the antibody recognizes a unique part of the foreign target, termed as an antigen. So our body, okay, kapag nagkaroon tayo ng antigen, okay, na pumasok na foreign body material, will try to make an antibody against it. The antibody is very certain for that certain type of antigen. Okay, so kung makikita niyo dito sa picture, okay, kung halimbawa itong kulay red is our COVID-19 virus, okay, our body will do or will try to make an antibody against that COVID-19. So yung area kung saan yung Y niya, na kung saan magbabind yung ating COVID-19, dapat specific siya para sa kanya para magkasya siya. Okay? So parang ano yan susi at saka padlock. Kung hindi tama yung susi na gagamitin mo dun sa padlock, hindi yan mag-open. Okay? Ganon din yung ating katawan. So halimbawa, pumasok ang antigen na yan at wala pa tayong antibody against that certain microorganism or virus or bacteria, okay? So pwede yung mag-cause ng medyo mas malaking problem sa katawan natin. Pero kapag meron na tayong antibody against that, it will try to kill that certain antigen in order to na hindi na siya kumalat pa at mag-produce pa ng certain pathological condition inside our body. Okay? So what are the types of immune reaction? Okay, so we have your innate immunity. From the word innate, meaning these are all your natural or native immunity that are present already inside our body. So these are mediated by cells and proteins that are always present and poised to fight against microbes and are called into action immediately in response to infection. So these are all your readily available antibody or immunity against a certain condition. So the major components of an innate immunity are: number one will be your epithelial barriers of the skin. Okay, so our body, meron na tayong mga epithelial barriers like our external skin, okay? Our ang respiratory area natin, meron tayong mga cilia, okay? So the gastrointestinal tract and respiratory tract, meron tayong mga ciliated area, okay, that prevents the microbial entry, okay? We have your phagocytic leukocyte, like your neutrophils and macrophages. We have a specialized cell type, which is the natural killer cell or the NK cells. And of course, we have the several circulating plasma protein that are important in our complement system. Okay? Another type of immune reaction will be your adaptive immunity. So these are your acquired or specific immunity. Usually, these are normally silent and response or adapt to the presence of infectious microbes by becoming an active, expanding, and generating potent mechanism for neutralizing and eliminating the microbes. So we have two types of adaptive immunity. We have your humoral immunity and we have your cell-mediated or cellular immunity. Your humoral immunity is usually called the B cell immunity because it is usually produced by your B lymphocytes, while your cell-mediated immunity is usually mediated by your T cell lymphocytes. Okay? So what are the cells and tissues of the immune system? First, we have your B lymphocyte. Okay? So your B lymphocyte usually participates in immunity either by directly neutralizing extracellular microbes or by activating the complement and effector cells, usually our neutrophils and our macrophages, to kill the microorganism. Okay? So it comprises the 10 to 20% of all the circulating peripheral lymphocyte. Okay? So madalas sa madalas, these are your humoral immunity. We have 5 basic immunoglobulin isotypes that are present in our humoral immunity. We have your IgG, the IgM, and the IgA that constitute more than the 95% of the circulating antibodies. And then IgE and the IgD. Okay? So your humoral immunity, usually it is mediated by soluble antibody protein that are produced technically by our B lymphocytes. Okay? So your IgG or your immunoglobulin G is the most abundant of all the antibody, and it is found in all bodily fluids, while your IgM, which usually found in the blood and in the lymph fluid, is the first antibody to made in the body to make a to fight a new infection. Okay, while your IgA is the first line of defense in the resistance against infection via inhibiting the bacterial and the viral adhesion. Okay, it tries to neutralize the bacterial toxins and the virus that usually introduce into our body. So the IgE and the IgD, okay, are usually reactants into allergen. So IgE, madalas na makikita natin yan sa ating mga allergic reactions. Okay? So while your IgD, it usually signals the B cells or the B lymphocytes to be activated. So madalas sa madalas, 'di ba, kapag 'di ba, yung test, yung antibody test against COVID-19, 'di ba, nakikita natin yan yung mga IgG, IgM kung magre-react yan. Okay? So pag nag-positive ka sa IgG or IgM, so madalas sa IgG pag nag-react ka dyan sa COVID test kit, okay, ibig sabihin nagkaroon ka na ng infection. Okay? So hindi siya pwedeng gamitin yung ating antibody test kit sa pag-detect ng COVID-19 kung yung COVID mo wala pang antibody na napoproduce sa katawan mo. So very important siya kapag meron na siyang antibody. Okay? Very effective siya kapag nakapag-produce na ng antibody yung katawan natin. Okay? So this is an example of a B lymphocyte under an electron microscope. Okay? So IgA is an important mediator for mucosal immunity, while your IgG IgE is an important for helminth infection or other allergic response. Okay. Next will be your T lymphocytes. It can either directly lyse the target, accomplished by cytotoxic T cell, or orchestrate the antimicrobial immune response of the cells. It constitutes the 60 to 70% of the lymphocytes in a circulating blood, and it present in splenic periarterioral sheaths and lymph node interfollicular zones. So this is your T lymphocytes under an electron microscope. Okay, so kung titingnan natin siya compared dun sa B lymphocytes, mas maraming spikes at very steep yung mga spikes ng ating B lymphocytes as compared with your T lymphocytes. Okay? Next is a macrophage, okay, or our macrophages. These are phagocytic cells and ultimately kill microbes coated by antibody and are complement or opsonize. Okay? So these are important effector or elements in humoral immunity and produces cytokines. Next, we have your dendritic cells. Okay, so from the word dendritic cells or dendrites, meron siyang mga galamay. Okay, these cells with dendritic morphology, okay, so occurs in two types. We have the interdigitating dendritic cells, occurs in lymphoid tissues, and we have your follicular dendritic cells located in the germinal center of the lymphoid follicles. Okay, so this is an example of the macrophages that can be seen in our electron microscope. And these are dendritic cells na kung saan meron tayong makikita mga dendrites just like with your nerve endings. Next, we have your natural killer cells or the NK cells. It comprise the 10 to 15% of the peripheral blood lymphocytes, contain asotropic granules, and are able to lyse a variety of tumor cells, virally infected cells, and some normal cells. It is classified as part of our innate immune system. So it is considered part of the innate immune system, which is very common in our immune system. Okay, so what are the features of the humoral and the cellular immunity? Okay, so we have the difference between the humoral and your cellular immunity. So the principal cells for our humoral immunity will be your B lymphocyte, while on your cellular immunity will be your T lymphocytes. Okay, and then for assisting cells, we have your macrophages, while on your cellular immunity, we have your macrophages and of course the T helper cells. The end results of your humoral immunity will be the immunoglobulins, while for your cellular immunity, it will be your lymphokines and your cytotoxic cells. So for your humoral immunity, ang lalabas dyan will be your IgE, IgA, IgM, di ba? Okay, so while you're effective against bacterial toxins ang ating humoral immunity, while your T or your cellular immunity will be effective against viruses, fungi on the transplant scenario and on your tumor cells. Okay, so this is an example of the natural killer cells. We go now with the hypersensitivity reactions inside our body. So hypersensitivity reaction implies that abnormal or excessive sensitivity into an antigen. So kapag merong pumasok na antigen, our body will try, okay, to kill that antigen, okay, try to lyse that antigen. So minsan nagkakaroon tayo ng hypersensitivity reaction. So it may result from a perfectly normal immune response to an antigen, okay, like your rejection of tissue grafts from antigenically similar donors, okay, and then we have it is classified on the basis of immunologic mechanism initiating the disease. So we have a subdivision of your hypersensitivity reaction. We have your type 1. So this is result from IgE antibody absorbed on the mast cells or basophils. We have your type 2 caused by humoral antibodies. And we have your type 3 that called immune complex disease. Okay, antibody bind antigen from a large antigen antibody complexes. And then we have your type 4 disorder, also called the delayed type hypersensitivity. Okay, so from the word delayed, okay, hindi siya basta-basta nagkakaroon ng reaction. Pwedeng after several hours or several minutes, saka siya nagkakaroon ng reaction. So these are self-mediated immune response where antigen-specific T lymphocytes are the ultimate cause of the cellular and tissue injury. Of course, we have the mechanism of immunologically mediated disorder. We have type 1 hypersensitivity uh, reaction or the allergy and anaphylaxis. So this is a tissue response that occurs rapidly within minutes after the interaction of allergen with IgE antibody. So this one is very rapid type of antigen. So the prototype disorder will be anaphylaxis, okay, from a bronchial asthma. Okay, other examples will be your allergic rhinitis or your hay fever. So your allergic rhinitis or seasonal rhinitis is an airborne allergy coming from particles characterized by itchy eyes, itchy nose, running nose, di ba? Sore throat, tapos meron kang nilalabas na excessive mucus, di ba? Minsan lumalabas na parang uhog or sipon sa inyong mga ilong. Okay? So this is also called your allergic rhinitis. So there are two well-defined phases of localized type 1 reaction. First, we have your initial response characterized by vasodilation. Okay, so tagi natin tatandaan kapag meron tayong immune reaction or inflammation, there is always a vasodilation. So nagkakaroon ng increase ng redness, and then nagkakaroon na ng mga vascular leakage ng ating mga fluids, and then nagkakaroon na ng muscle spasm, usually evident 5 to 30 minutes after exposure to an allergen and subsiding after 60 minutes. So mapapansin nyo, di ba, pag initial reaction, di ba, halos hindi ka makahinga, namumula ka, okay? And then second or late phase reaction that sets in 2 to 8 hours later and lasts for several days. So these are your mast cells and the basophils that usually develop or the central of your type 1 hypersensitivity. So what are the clinical manifestation of type 1? Okay, so we have your systemic anaphylaxis that result from systemic administration of protein, antigen, or drugs. For example, like a bibinum or penicillin. Kaya nga, di ba, as much as possible, when we are prescribing penicillin to our patient, let us try to dig deeper kung meron siyang allergic reaction. So what are the signs and symptoms, okay, of an systematic anaphylaxis? First, we have your itching, urticaria or hives, or skin erythema. Okay, so mangangati ka, nagkakaroon ka ng urticaria, which is some kind of skin rash, noted by a something like red raised itchy bumps dun sa skin natin. Di ba? Nagpapantal-pantal. Yun yung tinatawag nating urticaria. Okay, and then meron tayong skin erythema. There is a respiratory difficulty kasi nagkakaroon na tayo ng pulmonary bronchoconstriction, and then there's upper airway obstruction due to laryngeal edema, and of course, worst come to worst, we have vomiting and abdominal cramps. And then without immediate intervention, anaphylactic shock, okay, can lead into anaphylactic shock kapag hindi pa rin na agapan on the first 4 signs and symptoms, and then it can lead into circulatory collapse and death within minutes kapag syempre na constrict na yung ating area of air passage. Next, we have your local reaction. Occurs when the antigen is confined to a particular site by virtue of route exposure, such as on the skin, okay, nagkakaroon lang tayo ng urticaria, or on the GIT, nagkakaroon ka ng indigestion causing diarrhea. And of course, we have in the lung, usually inhalation causing bronchoconstriction. So madalas yung mga local reaction na to, nakukuha natin from any form of skin and food allergies, okay? Like minsan sa mga hay fever and other form of asthma. So the atopy is used to imply familial predisposition to localized type 1 reaction. So your type 1 hypersensitivity plays an important role in a parasitic infection. So your IgG antibody are produced in response to many helminthic infection or on the parasitic infection like your mga worms. Okay? So what is the pathogenesis of an atopic asthma? So halimbawa, naka-inhale tayo ng ating mga antigen, okay? Tapos meron tayong mga circulating specific IgE in our circulation. So yung ating mga antigen, papasok yan dun sa ating mga bronchioles. So our specific antigen, okay, itatry nila na i-pair, okay, yung pumasok na antigen sa loob ng ating bronchus. And then our mast cells coated with IgE, okay, will try to kill the antigen by degranulation of the mast cells. So ilalabas niya yung mga granules niya in order to try to kill that specific antigen. So yung mga granules na yan, pwede yung kumalat, okay, doon sa area ng bronchus natin that can lead into bronchoconstriction. So pag nagkaroon tayo ng bronchoconstriction, 'di ba? Liliit, 'di ba? Yung ating bronchus area, okay? Malilimit yung enter ng hangin natin. That is why nagkakaroon tayo ng difficulty in breathing and then magkakaroon na ng mucus hypersecretion and then magli-lead into bronchoedema or pamamaga ng ating bronchus na pwedeng mag-lead into circulatory collapse kasi nagkakaroon tayo ng decrease of oxygen inhalation. So mechanism of asthma, okay? There's an allergy. It can lead to inflammation of the bronchi and it can lead into mucus plug. So yung mga mucus plug na yon pwedeng magkaroon ng obstruction kasi pwede niyang barahan yung daluyan ng ating hangin. Okay? So inflammation, di ba? Alam naman natin if there is an inflammation, there are the presence of the 5 cardinals of inflammation. Okay, ano ba yung mga 5 cardinals of inflammation natin? Number 1, we have your edema or swelling. Okay, we have your rubor or redness. We have your dolor or pain. Okay, we have your calor or heat, and of course the functionalisa. Okay, so in our airway there is hyper responsive, which is usually genetic. We have other inducers that causes inflammation like your allergen or your pollutants. So kapag pumasok yan, okay, it can lead into bronchodilation, bronchoconstriction, difficulty in breathing, bronchoedema that limits our airflow limitation. Okay? Another triggering factors of reactions or allergic reactions will be exercise, di ba? Cold air kapag masyadong malamig, tapos bigla kang lumabas, babahing-bahing ka na, and of course, other diseases that causes allergic reactions. Okay? So this is an example of a normal bronchioles as opposed with an asthmatic bronchioles. Okay? Makikita mo kung gaano kalaki yung difference ng opening ng ating mga bronchus for a normal patient and for an asthmatic patient. Okay? So this is a lung with asthma, with mucus plugs. So makikita mo, di ba, there is a mucus or yung parang malasipon, okay, na nakabara dun sa mga bronchial area. Okay? So this is a mucus plug in asthma nung tinanggal. Okay? So ganyan yung itsura ng mga nakabara dun sa ating mga bronchial area. Okay? So microscopically, this is a obstructed or inflamed bronchi, okay, as opposed with a normal bronchi. Okay, sa normal bronchus, makikita mo large yung kanyang opening as compared with an asthmatic, okay, inflamed, okay, bronchus, halos wala kang makikitang opening. So technically, nahihirapang huminga yan kasi yung normal exchange of gases, di ba, hindi nangyayari. Next, we go now with the type 2 hypersensitivity or the antibody-dependent type of hypersensitivity. So this is mediated by antibodies directed against target antigen on the surface of cells and other tissue components. So the antigen may be normal molecules, intrinsic to cell membranes, or extracellular matrix. So usually this type 2 hypersensitivity occurs during transfusion reaction. Okay? Lalo-lalo na kapag nagkaroon tayo ng hindi nagmamatch yung blood na tinatransfuse natin. So technically, naglalaban yung dalawa. Okay? Naglalabasan sila ng kanilang mga antigen-antibody reaction, nagpapatayan silang dalawa. Okay? Another example will be your erythroblastosis fetalis due to the rhesus antigen incompatibility. So usually this erythroblastosis fetalis is a potentially life-threatening blood disorder in a fetus or a newborn infant. So ang nangyayari dito, okay, halimbawa mag-asawa, nakabuo na sila ng anak, so minsan yung kanilang mga rhesus antigen or yung RH nila hindi compatible, naglalabanan, nagpapatayan yung kanilang mga RH antigen. So ang nangyayari, imbes na mabuhay yung bata or magkaroon or mabuo yung bata, nalalaglag lang yung bata or namamatay. Kasi nga, naglalabanan yung kanilang antigen. Okay? Next, another example will be your autoimmune hemolytic anemia, a granulocytosis or thrombocytopenia resulting from an individual generating antibodies to his or own blood cells. So ang nangyayari naman dito sa autoimmune hemolytic anemia, okay, yung katawan mo nagpo-produce siya ng sariling antibody against sa sarili mong blood cells. Okay? So pinapatay niya yung sarili niyang blood cells. Okay? So ang type 2 hypersensitivity, ganun po ang nangyayari. Okay? Another example will be drug reaction where antibody is directed against a particular drug that is non-specifically absorbed to a cell surface. Example, in the hemodialysis that can occur after penicillin administration. Another example of type 2 hypersensitivity will be your pemphigus vulgaris caused by antibodies against desmosomal protein that leads to disruption of epidermal intercellular junction. We go now with the type 3 hypersensitivity reaction, which is your immune complex mediated reaction. This one is mediated by the deposition of antigen-antibody immune complexes followed by complement activation and accumulation of polymorphonuclear leukocyte. So technically, this one is a two-system complex, okay, or immune complex mediated. So immune complexes can involve exogenous antigen, such as bacteria and viruses, or endogenous antigen, such as your DNA. So the prototype disorder will be your Arthus reaction, serum sickness, the SLE or the systemic lupus erythematosus, certain form of acute glomerulonephritis. So these are the diseases usually caused by type 3 hypersensitivity reaction. Okay? So what are the pathogenesis of systemic immune complex disease can be divided into three phases. First, we have your formation of antigen-antibody complexes in our circulation, and then deposition of the immune complexes in various tissue, okay? And then number 3 will be an inflammatory reaction in various sites throughout the body. So we have the Arthus reaction, okay? Which is a localized area of tissue necrosis resulting from acute immune complex vasculitis. So when we say vasculitis, it refers to a heterogeneous group of disorder that are characterized by inflammatory reaction, refers to as the heterogeneous group of disorder, like destruction of the blood vessels. Next, we have your type 4 hypersensitivity reaction, which is also known as the cell-mediated reaction. So this mediation usually by specifically caused by the type, which caused by the T cells rather than the antibodies. And it is usually subdivided into two basic types. We have your delayed type hypersensitivity, and we have your direct cell cytotoxicity. Okay? We go now with transplant rejection. Hindi porket compatible kayo, okay, ng certain organ, hindi na yan i-reject ng katawan natin. Minsan kahit kidney pa yan, upon testing, okay, compatible naman kayo, na i-transplant yung kidney, naging okay yung kidney transplant, pero after 2 to 3 months or after few months, nagkaroon ng rejection, normal na pwedeng mangyari yon due to transplant rejection. So your transplant rejection is a complex immunological phenomenon involving both cell and antibody-mediated hypersensitivity responses. It usually, the classification of this rejection, number one will be a hyperacute rejection occurs within minutes to few hours after your transplant. And then we have your acute rejection that may occur within days to weeks of transplantation. Okay, while your chronic rejection, it is clinically present late after transplantation, around 4 to 6 months nangyayari. So pwede pa rin ma-reject, okay, yung ating transplantation. So I think that's the last part of this lecture about immunity. So by Charles Gordon, if you tell the truth, you have the infinite power supporting you. But if not, you have the infinite power against you. Okay? Again, good morning. That will be the last part of